So New South Wales recorded 136 locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and there were 86,620 tests. Whilst there were no deaths recorded in those data, as the Premier has said, tragically, an 89-year-old male has died, and we won't be releasing further information until we've ensured that the family are aware of that case, and my condolences to that family that's impacted. I have advised the government today that this is a national emergency and requires additional measures to reduce the case numbers. What we are seeing is that the actions taken to date have averted many cases, but what we are not seeing is the turnaround that we would have liked to see at this stage. And I am concerned that we need to put in place urgent additional measures. What I'm recommending strongly is that our vaccination efforts are refocused on those affected LGAs. Every day, people from those LGAs have to go out to work to keep our city going. They are doing critical food production, critical work to keep society functioning. And we are seeing cases introduce the virus into various workplaces. We are also seeing significant household-to-household transmission, and it's been very challenging to interrupt those transmission chains. So the two areas that I've requested that we urgently focus on is redirecting all vaccine initiatives to southwestern Sydney and Western Sydney, particularly the affected local government areas, that we work in partnership with the Commonwealth to deliver both Pfizer and AstraZeneca, consider the use of the Pfizer in the younger working population in order to prevent the spread. Now, the rationale is that I've talked a lot about the individual benefits of vaccination. The individual benefits of vaccination are so clear. Both vaccines are very effective at preventing against severe illness and hospitalisation. And I can't urge the community more in a broad scale to take up any opportunity to get vaccinated. We also know that, as I indicated, that the group of workers that keep the society going is this group of workers in the 20 to 49-year-old age group in southwestern Sydney. Under 40s would not have been routinely eligible for vaccination in terms of Pfizer, and what I've recommended to government is we urgently do mass vaccination of those workers to stem the transmission risk. We know the vaccines do that because they reduce the risk. If you're vaccinated, even one dose, it reduces your risk of onward transmission. And so that, again, is an additional strategy we need to put in place. I would also like to say that I've advised that we also need to work very closely with the impacted communities and leave no stone unturned in terms of the support we can provide people, recognising the reasons that they may have difficulty isolating or following the public health requirements. And can I just say, my heart goes out to the people in southwestern Sydney and Western Sydney for the impact this virus is having on them. In terms of the suburbs that are impacted by the updated list, I'll read out the suburbs so that people actually are aware of it, because they may not be familiar with their local government areas. So the suburbs that are under the stay at home will be Cumberland, Marylands, Greystanes, Guildford, Pendle Hill, Girrawheen, and then Seven Hills and Blacktown. So they're the new areas that we've added, remembering that we have the other Fairfield local government area and County Blacktown government area and Liverpool local government area already with only authorised workers leaving those facilities. So my key message in summary is we need to follow the public health advice. I can't stress this enough, that the actions taken in locking down, reducing mobility, wearing masks indoors, wearing masks outdoors when you come anywhere near anyone, are all effective strategies. We need to stay the course. And I know that that is very hard for people, but we need to stay the course. But what I've also recommended is we need to do more. We need to redouble our efforts, and I've indicated to the government that we need an intensive vaccination program using both Pfizer and AstraZeneca in that area. And I would recommend to anyone across New South Wales to make a booking for AstraZeneca and to get their dose of AstraZeneca regardless of where they live, whilst we are developing a very targeted and intensive strategy in that southwestern and Western Sydney.